Welcome back to Focus on Health. In case you're joining us right now, we're talking about anxiety and COVID-19. COVID-19 is on the rise, and the number of infections has actually turned into names of people that we know, names of people that are our friends. So how exactly do we manage anxiety in the face of COVID-19? So Dr. maybe you could pick it up from where we left. What are some of the types of anxiety disorders that we have? Maybe you could explain to us in a more detailed way.
Thank you very much for that question. Anxiety disorders are very different. We have what is called free floating fear. That is generalized anxiety. The generalized anxiety is a condition where the person is feeling fearful, afraid, but they cannot pinpoint exactly what it is that they're afraid of. And if that condition is not attended to, then that person can be incapacitated in the sense that they are not able to conduct the business of daily living because of that fear. Yes. Then the other anxiety disorder is phobic disorders. The phobias, you find people who are afraid of little things like being afraid of climbing a ladder, being afraid of heights, somebody who cannot use an escalator, somebody who cannot give a speech in public. The sheer thought that they will stand and give a speech makes them sweat and stammer and forget everything. Then we have obsessive compulsive disorder. These are intrusive thoughts, a thought that comes and intrudes, and one has no control over that. Those intrusive thoughts lead to obsessions. Obsessions are behaviors that a person might repeat.
Doctor, you know that you've talked about the types of COVID-19. What effects do they have in our day-to-day lives?
Thank you for that. Anyone who has an anxiety disorder, and this disorder is not addressed, that disorder will impair the life of the person to the extent that they are not able to run the affairs of their lives. Yeah, like being able to wake up and go to the office, like being able to wake up and get to the day's business and so on. Yeah, so it interferes. And if anxiety disorders are not treated early, before they get very complicated, they might become serious mental health problems.
Doctor, do the panic attacks you talk about, do they just happen, like maybe you're just maybe at work or at school and you just get a panic attack out of nowhere?
Unfortunately, people do not have control over when a panic attack sets in. Although sometimes there are trigger events. There could be trigger events, something you saw and so on, but at other times they just come on suddenly, and therefore they are very, very scaring. And even the fear that that panic attack may come in will complicate the situation. Yes.
Doctor, maybe now we could talk about the management of anxiety. How do you go about managing an anxiety disorder?
Managing the anxieties will require, first and foremost, becoming knowledgeable. And today, very fortunately, these are days where we have technology. People can access information. So somebody needs to access information like how I am feeling fearful, I have this disorder. What is this disorder? What is it all about? What are the things that I can do to manage it? And of course, because it's a disorder, a person cannot self-medicate and say, I will self-medicate through doing this and that. The person needs to actually access professional help. The professional helper is a counselor or a psychotherapist or a psychiatrist, whoever may be near. That helper will diagnose the kind of problem it is and come up with a program that helps the person overcome the fears. So these programs include cognitive behavior therapy, where the person is trained how to understand their thoughts, their beliefs, and confront them and change those perceptions, which will definitely overcome the fear. Another method that will be used by either the counselor or psychotherapist is exposure, in a way that exposes the person to the feared object systematically. So it is called systematic desensitization. So these are some of the things. Other things that the person is trained to do is relaxation techniques. That when you're thinking about that fear arousing object, you can learn to think about it and relax. The other things that are encouraged are healthy lifestyles, avoiding alcohol and drugs, and healthy eating, exercise, and rest. And of course, engagement in pleasurable activities. For example, when that stressful thought, when it comes in, the person can take time out and maybe go and do something nice, make yourself a cup of tea, play with a child, tend a garden, or even sing a song, pray, or yoga, and so on. Being spiritual is also encouraged. Yeah, and seeking good company is also encouraged. These are some of the ways, some of the methods that help deal with the anxieties and the fear. You know, anxiety disorders and other mental health issues, the diagnosis many times comes during adolescence. Not necessarily, there are those childhood disorders, but when we talk about anxiety disorders themselves and other mental health issues, those ones are diagnosed mostly during adolescence. And if let's say someone is having a panic attack, they may start hyperventilating, breathing very hard and in and out and very fast, to the point that sometimes you find that somebody is actually fainting. Or another way of noticing that somebody has a problem, somebody can just faint and there is no good reason why that person has fainted. Somebody can just tell you they're not seeing, yet there's no problem with their sight. Somebody can go numb, yet medically there's absolutely no problem with the nervous system or with the musculoskeletal system. So this is why many times and other times it is good to see a professional to diagnose and set up a treatment program.
So, Dr. Is it normal to have anxiety, and how do you tell a normal anxiety from an anxiety disorder?
Anxiety in itself is a normal thing to have. In fact, absence of anxiety is abnormal. Why anxiety is normal is because if a person does not get anxious about things, like being anxious about an exam somebody will be taking tomorrow, being anxious about an interview somebody will attend. If somebody is not anxious, they will not have the energy or take the time to prepare for such. But because of the anxiety, they are thinking about it, then they put time aside to prepare for it. To that extent, anxiety is okay. The problem with anxiety again is if it is in excess. If it is in excess, then the person may not be able to engage in the behaviors required to prepare for that exam. Or they may think they have prepared, then they go to see the exam, and because they have excess anxiety, then they just black out. They had read, but just then this idea looks very easy. I had read, but I cannot remember it. This is because of excess anxiety. So that is anxiety at that level. Now, when we're talking about now the neurotic anxiety, this is now the one which is actually a mental health issue. And this is the one that actually requires the attention of a psychologist or a counselor or a psychotherapist or a psychiatrist. Yes, depending on what is presenting. Yes.
Dr. So maybe now we could talk about a question that was asked on our social media platforms. We have people that maybe are affected by, the social media. In as much as you should be informed, maybe they will go to the social media and they will see something about COVID-19 or just generally anything, and it would trigger them. Would you encourage them to maybe like declutter and stay away from social media to avoid getting these anxiety disorders?
You see, social media is good and very good because there are ways in which we use it and it helps us. But there are ways also that social media is related to mental health problems. The moment a person notes that the use of social media is leading to anxiety, it is time to rethink. It is time to take a break. And taking a break, when people take a break, they feel good. I am sure we have seen people who have said they are so tired of all the nasty things said to them, said about how they dress, how they look, who they went out with, where they were seen, until somebody feels like they want to commit suicide. Sometimes it is just right and fair to just give social media a break. Yes.
Dr. Maybe now you could take us through the prevention measures of anxiety disorders.
Preventing anxiety could be difficult, but there are certain things that we could do that will ensure that our anxiety is kept at minimum. For example, being planful. We plan systematically and we execute those plans. When we plan ahead and we follow through our plans, then it will reduce the anxiety. Also, being knowledgeable about situations that make us anxious and knowing how to deal with them may also be preventive. But you cannot entirely and completely rule out that anxiety will be part and parcel of life. Yes.
Do we really have a cure for anxiety disorders?
Yes, we do. Therapy is a cure to anxiety. That is, any person who is suffering from neurotic anxiety needs to be attached to counseling or psychotherapy, and they'll be taken through steps that will lead to cure. Yes.
So Dr. Now, even as we wind up the show, maybe you could hear your parting shot to our viewers regarding anxiety and COVID-19.
The parting shot here is that we are encouraging everyone to actually know what COVID is all about, how it is contracted, how to prevent oneself and other people. And we are also encouraging people, if they are feeling unduly anxious, and this is anxiety they cannot deal with, to seek professional help. Yeah.
Thank you so much, Dr. for your time. It's been a pleasure, and thank you so much for educating us more on anxiety and COVID-19. So we've come to the end of our show today, and there you have it from Dr. Anxiety is normal. In fact, if you're not nervous about maybe an interview that we just had with Dr. or maybe a test, it's actually abnormal. So let's create awareness on mental health, let's create awareness on anxiety and how to prevent it and how to manage it. I've been your host, Bwari Michelle. Don't forget to always hit us up on our social media platforms at KUTV Focus on Health on YouTube and Health Focus on Instagram. I will leave you with the Health You segment. Until next time, stay safe and stay healthy.